My name is Eva Bruhin and I work for the Swiss Federal Office of Public Health. I'm the head of the division called Prevention Strategies, and I trained as a psychologist, specializing in health psychology, and then afterwards I did a degree in public health. And I am very lucky because I have a great team, and also I have a, I think, quite progressive employer, which allows me to work part-time. So in my spare time, or in the time where I'm not working for the Federal Office of Public Health, I also work as a garden and landscape designer, and I'm a yoga teacher, and I'm very fascinated by modern art. And then also I love to be outside in nature, either hiking or mountain biking or cross-country skiing or running, but it's nice to be outside in nature. I really love being in nature. I grew up in Switzerland, part of the time in Switzerland, and the other part I grew up in the Principality of Liechtenstein, but I'm Swiss and half Swiss, half English. You might hear it from my accent. I'm not used to talking English in my workplace, but my accent is probably quite English. My team and I, we develop and also implement national prevention strategies. So that means, where do we go as a nation, as Switzerland, in the field of health promotion and prevention. And of course we need to work together with other players such as the cantons, which are really very important for health promotion and prevention. And so together with those players we ask questions such as, well, what needs to be done so that the Swiss population stays healthy, can lead a healthy lifestyle, finds health promoting circumstances to live in, and where are the problems, where might future problems lie concerning health, and what can we do about that. And so right now we are implementing two big strategies. One is the prevention of non-communicable diseases such as cancer, but also mental disorders or cardiovascular diseases. What can we do to prevent those diseases on a population level? So there we talk a lot about promoting physical activity, for instance, promoting also social engagement, promoting healthy nutrition, but also we talk about how we can prevent people from smoking or drinking too much alcohol, things like that. And then we have the second strategy, which focuses on the prevention and therapy, also harm reduction of addictions. And there we talk about substances which could be possibly addictive, like maybe illegal or legal. Legal would be, for instance, alcohol consumption, too much alcohol. But we also talk about potentially addictive behaviors, mostly online behaviors such as gaming or also now gambling, which has become very strong, like the online casinos. So in lockdown that became very frequently used because the casinos were closed, the casinos in the cities. So gambling online is a big thing. I could talk about these questions for hours and hours, but I will focus on 2 points. So the first one is that I think we're becoming increasingly sedentary, and also we're leading an increasingly virtual lifestyle. so that a lot of the time we're spending seated in front of a computer or some kind of device, and that changes the way we as people live our lifestyles. So, for instance, where do we go to if most or many of our relationships, doesn't matter if they're private, on a private level or on a work level, are virtual? Where do we go with the real social contacts, with the contacts we need, also with personal skin contact, whatever, shaking the hand of another person? So I'm convinced that this will have an impact on our health. Also, when we are seated most time, of course, there are questions about physical activity. How do we still get to move? How do we still get outside, spend time in the sun, spend time with other people, spend time in nature, for instance? So I think with technology or technological solutions growing, and with us being many hours of the day on a virtual reality, more or less, we need to consider what is happening with us, and how can we still stay in contact with real life and with our body and with whom we are. This is one theme, and the other one is a more a critique more of our health system. So our health system mainly is thinks about healthcare, and if we look at the health expenditures in Switzerland, almost 98% of the expenditures are spent on healthcare, and only a little bit more than 2% on healthcare, health promotion and prevention. But if we are really interested in having a healthy population, we need to switch this way of thinking. We have to ask firstly, well, what do we need to do, and how much money do we have to spend in order to have a healthy population? And then the second question will be, how can we support people who need health care, but not the other way around? And our health system thinks the wrong way around. And that's why I think we still have a lot to do also in the future.